Good afternoon, everyone. This is Christine at Health Current, and thank you so much for joining us for the HIE 3.0 overview and transition presentation. Our guest speakers today are Christy Dye, our Chief Business Development Officer, as well as Keith Parker, our Chief Information Officer, and Cindy Manning, who is one of our technical account managers, will be providing the demonstration of the new platform. Keith, are you with us today?
I am. Are we ready to get started, Christine?
We are going to be recording today's presentation, and we want to encourage everyone to use the chat feature throughout the PowerPoint presentation or the demo today to ask questions. Thanks again, Keith. It's all yours.
Well, thank you, Christine, and welcome everybody to a very exciting presentation of how far we've come in transitioning to our new platform and how we are looking to transition all of our end users. So very exciting day. It's been a day long in coming. So with that, here's our agenda. We're going to give you a brief overview of our new HIE 3.0 platform. Then we're going to go into a portal demonstration because, a demonstration is just that. It's a heck of a lot better to see what you have than a PowerPoint. So we are thankful to have Cindy here to be able to walk us through some of the new features and what our portal looks like and feels like that we are currently rolling out. And then Christy's going to talk to you about really the meat of this. What we really want everybody to do is get excited about transitioning over your current services, specifically alerts and portal access to our new environment. And we have some timelines on that, and Christy will be going over that at the very end, and then some time for questions. So really quick, a quick Arizona HIE history, right? HIE 1.0, we had several HIEs here in Arizona, and over the course of years, up to 2017, we really worked to rebrand and consolidate all those HIEs into one. And in doing so, we went through several or a couple different platform changes. For those of you that have been with us for quite a few years, it's going from the old Axolotl and Lotus Notes days to the Mirth days to a NoSQL Postgres database cloud-based days, which is what we're transitioning to. And I want to actually, as we go through that, go over what is our HIE 3.0 platform. And it really ties into our history and how we got here. So over the past, holy cow, I oftentimes like to say we're about 20 years into a 2-year implementation nationally for interoperability. And that transition has been one from local HIEs using local servers to be able to connect and facilitate the movement of data to the use of application programming interfaces or APIs, FHIR APIs, as well as cloud-based technology that make it easier to move large amounts of data as well as store, aggregate, and ensure data fidelity. So our HIE 3.0 platform is really a platform that has been redesigned to aggregate, that is scalable, that can move that patient data across disparate sources and do it from a large data or big data perspective as well. So with that, holy cow, I am just going through the slides very quickly. Let me go back to slide number 3. My apologies for that. I am butterfingers on the mouse today, between the mouse and the enter button. So let me take my hands away from the mouse and move on with this. So our HIE 3.0, and I went one slide too far. No, I didn't. I'm actually right on the money. So platform benefits, what we're looking at is an improved user experience, an improved patient and clinical searches experience, system performance, system scalability, EHR interoperability, data management, security protection, and reporting. So what does all this mean? This means that we're transitioning to an environment where all the data is in the pool together, making it easier for you to access that data. It's also an experience that takes that data from a data fidelity perspective, normalizes that data so we can see it across systems and make it more usable. It's also a system that allows us to start moving larger data sets based on our end users and what our end users are looking for. So we're really maturing to be able to have a platform that doesn't just aggregate data, but brings data in, standardizes it from our data sources, puts it into a platform that's accessible, and then makes it accessible and usable to our stakeholders, our end users, not only across Arizona, but across the country, as you're going to see in future or other slides that were connected with national infrastructures as well. So moving forward, connected health solutions. So this really kind of goes through where we're at with, holy cow, I am just having a heck of a day when it comes to these slides. You would not know that I spent a little bit of time actually rehearsing. Maybe I do better when I just come in and actually talk to this. Here we go. And the graphics are coming up. So connected health solutions from this perspective. It really starts with the HIE 3.0 in the middle, which is our clinical data repository. It's the Next-Gen Connect, and I put Next-Gen Connect in here because it's the old Mirth Connect platform, which is an open source. It's a platform that facilitates the exchange of the data back and forth. So it automates inbound and outbound data, and it acts as those doors for data coming in and how data is going out as well. Then to provide access to hospital providers and apps. This is where we're also connected with Sequoia, eHealth Exchange, direct messaging, and patient-centered data home. So it gives us a heck of a lot of versatility. And then down here, other applications and data support. And I put in other applications and data support because it's really important that now that we're in an API-first environment that scales differently, aggregates and stores the data differently, we can support based on those APIs that you're looking to put in place for your organizations to meet your organization's needs. So if you're moving forward with a pop health or an analytics platform, you need feeds to be able to go into that, we can support you. We can do this from an automated perspective. We can do this from a pulling data through API calls and moving it to you. We have a lot of flexibility at this point moving forward. So key features: content management, APIs, user portal, consent, data protection, cloud hosting. I want to key in on this one because I've gone through a couple of these on the consent and data protection, and I'm going to go a little bit or take a little deeper dive in this as well. Data protection and consent is what I would describe a complete circle within this environment. It's not just about the patient providing consent. It's about how we tag data as it comes in from the data source. It's about how we set up data source groups based on the protection level that data needs. It's also about the patient and how the patient consents for his data to be viewed, and specifically around federal guidelines and SAMHSA 42 CFR Part 2 as it pertains to protected data. It's also about how we set up roles and role-based access coming in. So these key features now work by working in the same database or in the same data structure. It gives us a lot more flexibility to give or to provide that single portal sign on, and you have access to everything based on your role and what you're authorized to have access to. That also equates to the automated portion, if you remember from the slide before, when we set up alerts, when we set up data queries and data response to where we're providing reports or CCDs, continuity of care documents, back to you based on automated data feeds. So all that applies to all the different types of transactions that this environment is capable of providing across the board. So it's really important to look at that. And then from a cloud hosting perspective, we're being managed by a system that we're working with that is scalable based on our abilities or how we're growing here in Arizona. So really important that we look at it from that perspective. And I went the wrong direction. So let's keep moving forward. Key benefits I just reviewed, key features I reviewed, along with the key benefits, data fidelity, usability, scalability, and configurability. Now, a couple areas on here that I really want to point or call out, and I've said this a number of times, is we are an API first environment. And from that, the data fidelity, the system retains data provenance and provides seamless merge and unmerge capabilities. So from an API and API calls and the data sources, we can actually identify where that data comes from and maintain data fidelity across. So if something happens to where we need to cut down or reduce or restrict data access, we can do that across the entire environment based on that data source, based on the roles, based on what is authorized to be able to be seen. Usability. From a navigation and a UI perspective, I'm going to leave that to Cindy because Cindy's going to show you how our new environment from a portal access is usable. And what I want to speak to this from a usability perspective is the automated perspective. A lot of you, what you're seeing in some facilities, if you're in some of the large hospitals where we've set up some of our dynamic alerts, that are alerts based on triggers to where I just registered for the ED, these are all automated transactions that we're building into this environment. So if we're doing our job right, all you're seeing as the provider is data, where you need it, when you need it, and or where you need it, when you need it for your care navigators, for your providers, across the board. So really important that we look at usability, not just from a portal perspective, but throughout the entire aspect of our new environment. And then scalability. This is something, since I've taken this position 4.5 years ago, going on 5 years, we were under a terabyte of clinical data. We're now growing at 1.5 terabytes a month as we're increasing our interoperability into our data sources and our data users. From a data use perspective, when I started in this position, we were sending out probably well under 50,000 alerts a month. Now we're up north of 10 million. So we're taking it very seriously, our ability to scale and close that data loop. That's the data coming in, making it usable and getting it out to the end users, either through through alerts, portal, or data queries or reports going back out. So extremely important. So data fidelity and event sourcing. So what we're talking about here, and I've already hit on it a little bit, is we're able to trace from a data fidelity and event sourcing exactly where that data originated from. We're able to store it as either local patient encounters, labs, medications, immunizations, and still tie it back to the original data source. So again, from a fidelity perspective, we can go in there and restrict access and or open up access based on roles and what is and or is not authorized for both state, federal statute, and our permitted use that's set forward by our board and our governing council. So it's really important that you understand this because it is one of those concepts that from a database where everybody's in the pool, we have to be able to connect the data across our entire spectrum. So data protection, this comes down to, and I've already spoken to it a couple times, who is and is not authorized to see it. So from this perspective, if I go back and we have all the data going and data or Dr. Monroe is not allowed to redisclose the data, but he is authorized to see it. He needs to be aware of that, and it has to come across to Dr. Monroe with the appropriate tag stating that it is protected data. So Dr. Monroe knows not to redisclose in accordance with SAMHSA guidelines 42 CFR Part 2. If we didn't have this infrastructure in place, this would be a very difficult task that a lot of HIEs and a lot of organizations struggle with. So it's an important application or important functionality that we have with this environment. At that point, Dr. Monroe then, or whoever that individual is authorized to receive that data, knows who he can and who he, or knows that it is protected and that he's not able to share it unless he has the appropriate consents in place. So moving forward from a patient aggregate perspective, and this is going to go into a little bit of layers and how we've layered our environment. So our patient aggregate data is made up of data from across the entire spectrum. So we look at Keith Parker's data information, not as if I'm in my medical record, but I'm in everybody's record. And all that aggregated information comes into our environment that makes up for that patient record that we have in our environment. So from this perspective, we go through and from everything that I've talked about, we're able to apply different layers, and those layers are role-based or come back to a role-based on who can unlock the keys or who has the ability to reach through those layers to pull out the data that they want available to them. So everything's aggregated at that patient level. We have all the information, physical health, behavioral health, protected data, non-protected data, except under HIPAA, all in there. And then based on data access constraints, confidentiality, privilege, consent, and then you're going to see role, we can determine based on the roles in those layers what those individuals are authorized to see. The other piece that I want to start off with is this all starts with how we set up the data coming in from the data source. So now as we apply this and we take a look at who the users are, those users have to have the appropriate set of roles-based access to be able to view that patient information that is protected or the patient information that they're authorized to see. So extremely important. We take permitted use and authorization and roles-based authorization extremely serious on how we provide data back out. So from this, again, what I was talking about earlier is we've got our clinical data repository with data sources coming in from across the healthcare continuum, and we're able to divide it up and understand what is protected and what is not protected. And divide is probably not the right word. We're able to tag or identify that data inside the same environment, right? And then at the end of the day, we're able to identify what is or is not authorized. Because also from a Part 2 perspective, the HIO or state statutes here in Arizona don't allow for break the glass, Part 2 does. With this functionality, we're able to have the right data in the break the glass available to those providers that need it in an emergency situation in accordance with national guidelines. So again, and I've already spoken to a lot of this, the non-protected versus protected starts with the data sources, how we tag the data sources, and then we then apply the different layers. And then based on that, user roles and the individual, how those roles are given will dictate what data that role may or may not access within the environment. So all extremely important concepts, all very cool features in our new environment that is scalable, application programming interface first or API first environment, meets national needs moving forward as far as FHIR-based, API-based, meeting the needs of where we're going on some of the national direction. So it's extremely exciting how far we've come over the past quite a few years to get to this place. So from that, and I've already spoken through a lot about this, some of the layers based on the role are not authorized. Some are based on that role-based access and how we apply the data when it's coming in. Now with that, I'm going to stop sharing, and I hurried through the last few because one, I got flustered when my presentation button wasn't working correctly, and two, this really gets to the cool part, which is what Cindy's going to show us. And Cindy, I'm going to stop sharing so you can go ahead and start sharing. And the cool part about this is what Cindy's going to show you. Actually, our environment. It's a training environment, or it's an environment with training patients, because we can't be showing real life patients from that. And I want to allow time toward the end for questions and answers that you may have about this environment as well. Cindy?
Thank you, Keith. So welcome.
Cindy, are you there still? Can't hear you. Uh-oh.
Cindy, I see that you are still connected, although it looks like you may have lost your audio. Cindy, this is Christine. If you can hear me and you're able to reconnect. Oh, looks like she might be connecting.
So Cindy, I saw that your screen was changing. Are you in the chat? Are you able?
Keith, I think I also have Sarah Cole on the line who could also do the demo.
Well, Sarah, if you could go ahead and bring up our demo environment while we're giving Cindy just a minute.
Absolutely. I already have it open, so let me share my screen here one moment.
Okay. Cindy, if you could stop sharing and we will transition over to Sarah at this point. And I would say, as Health Current CIO, this is our demonstration platform. This is not our environment that we're in. So this is WebEx or webinar.
Okay, can everybody see my screen?
Yes, we can. Thank you, Sarah.
No problem. So this is the training environment. So these are not real live patients, but here we have the ability to do a demographic search. But we also have the ability to do advanced searches, whether by diagnoses, medications, and so on, along with other demographic information. And then we've got our search reason. This will be dependent upon which role you are currently logged in with. So if you're logged in as a medical provider, you're only going to have search reasons regarding medical providers. If you're a health plan and so on. This is so that if anything needs to be audited on why someone looked up a patient based on their user role, we can go back and look at the search reason. So here I'm just going to say I'm doing this for case management. I'm Tilly Gossick. And then I have the ability here on the left-hand side to further or filter that search if needed. But I'm just going to go ahead and open up Tilly's information here. And Keith had mentioned that a lot of the information is aggregated. It is a lot easier to view than it was in Mirth because everything is now in data cards. So encounters are in one card, allergies in another, results here, and so on. Within the data cards, we also have the ability to search for clinical items. So if I am looking for a specific condition, let's say for Tilly, we're going to do a clinical search here for, let's see, just conditions. We can actually put in a condition here, do a search, and then it actually brings up that clinical item that you're looking for, and you can further gather further information here by clicking on this to see who the data provider is, when it was administered in the system here, and then you can actually go into the actual clinical details so that you can see further information regarding Tilly's condition here. And I'm going to go back to my search results here because Keith, did you want to display the break the glass?
Let me unmute. No, we're going to do that in our behavioral health portion.
Okay.
Integrated clinic. So I think concentrating just on the functionality that we have within this environment.
Gotcha.
From a physical health perspective.
We also have some new features within HIE 3.0 in addition to this clinical item search. From here, if I only want to view data for one specific data card, I can go in here and just look up immunizations or their family history, accidents, and so on. And one feature a lot of participants have been asking for is the ability to filter by date range. Because have patients, and a lot of times they remember I had knee surgery back 10 years ago, but I don't remember who it was with or what happened. Here we can now filter by date ranges, by data sources, and providers and provider groups. So if you need to search for any banner encounters and so on, you can do that here. We also have the ability to pin patients. So if you are interrupted or if you're charting and you want to go in and review the data at a later time, or you just need quick reference to that patient record, you can go under here under actions and you can pin patient. Another feature that is new to HIE 3.0 is subscribe for patient notifications. Very similar to alerts, but this is going to allow a single user to actually go in and subscribe for a patient notification. And that notification would be delivered either to the portal itself, which would display down here in the notifications, or in the work list, I'm sorry, over here on the left-hand side, or it would allow you to have that delivered via email. In the future, we can have that delivered to the EHR. You want to download the any kind of documents, you can download them from here, and you can also share. Within the data cards as well, we also have the ability to aggregate information by tabs. So we've got labs, we've got imaging, transcription, so you're going to see multiple tabs on problems, diagnoses, and you can go and further filter and view those. If there are duplicate entries, you'll see this number 2 here next to it, meaning there were 2 clinical items of anemia and chronic kidney disease within this record. And you can actually go in here and you can download and share this document. So if you need to share this with another secure provider, meaning somebody else who has direct secure mail, or you can download that clinical item and generate a PDF from it as well. And then of course we've got our back button and we've got our breadcrumbs at the top so that we have easy navigation to return back to your summary page. An additional new feature within HIE 3.0 is the new patient summary view. So if I click on toggle this on, I can actually see all of the pertinent information for this patient, their admissions, their care providers, clinical data, social history, and so on. One other feature I think that a number of participants will enjoy is the ability to configure the layout of this summary page. Let me move my screen here. So here I can actually configure the layout. And if I wanted to move conditions up to the top of the screen, or if I wanted to remove one of the data cards, I certainly could. So you could just grab this and move it on your screen depending on where you want it, and resize it. And then once you're done, you can save it. Or if you decide, hey, I really wanted it the way it looked before, you can restore it to default. So if I save this, my conditions are now at the top, so this is configurable per user. It does not change for everybody else. Down here, we've got notifications. So anytime there is an action that is performed, you're going to get a notification. It also has action items for each user. So if I've downloaded a document, it'll notify me that the download has begun, and then you'll get another notification with the number 1 here on the bell, letting you know that the document is ready to download. I had mentioned pinning the patients. This is what it looks like. So if I wanted to pin my patient right here on the patient list, I could see pin patients plus my last 4 that I've visited. And then if I've set up any kind of notifications, they would be here in my work list. And it's very easy to set those up. In the mandatory training that Keith is going to talk about, everybody's going to be provided with job aids, videos, in a webinar in order to get used to navigating around the system and being able to use it. And I apologize, Keith, I went through that very quickly because I wasn't sure how long the demo was supposed to be.
No, this is really the part to where I wanted to take some time. If you could also go up to in the top right, if you could go back into the patient under the active portion, and also show how we can, in our new environment, you can actually add patients to be alerted on as well. Are you familiar with that, Sarah?
Yes.
Yep. And I think this is an important feature because in the past, you would have to upload a patient panel. Now, if you want to add a patient to be alerted on, you can go here, Sarah.
Yeah, so you're going to click on Add Patient Subscription. I do not have a direct secure mail, so I can only show you a portion of it. But here we can see what kind of a notification you want to receive, whether it's an ADT alert, whether it's an inpatient emergency transfer IP, outpatient visit, emergency discharges, and so on. So these are a number of templates that we've built. Sorry, question, Christy? Okay. You can also say, I only want to be notified once, or you can say, I only want to be notified for the next 60 days because I know that my patient is high risk for that time until they get a procedure done, whatever that happens to be. And you can choose the work list notification here. And if you choose this, you will get a notification within the portal itself saying, hey, you have a notification for Tilly Gossip. She was admitted to the hospital, the emergency room. or you can have it sent to you via direct secure mail. That'll be through a PDF. And eventually we will have the ability to deliver this to your EHR. And then if you want to add a custom notification, you can certainly do that as well. And then you will have instructions for this in the training that we are going to provide for all users when we migrate everybody over. Anything else you would like me to display, Keith?
Well, we've got lots of questions coming in. A lot of them have to do with consents being managed through automated exchange as well. That was me to everybody on the consent side. I think those were the primary areas. Christy, go ahead.
I saw one of interest. Does the share feature go to only direct messages or outside email addresses?
So they go just to direct secure mail.
Yeah, in our environment, and having submitted for our HIE trust and following state and federal guidelines, we can only send to from a certified perspective. So we use direct secure email. We can do it through, we're working toward being able to do it if you have a full interface through those interfaces or through SFTPs. So you need to get into our environment, send it through to a direct secure email. You need to be able to send it into an SFTP, which is in our environment, or we need to have a full-blown bidirectional interface with your system to where we build out how that exchange goes back and forth as well.
Keith, would you like me to show the demographics and where consent is managed?
Yeah, I think right now that would be a good idea. I would say yes.
So
because I did put into the chat that was asked, and consent manager is going to be one of our roles. Sarah, go ahead.
Correct. So more patient information is located right here at the top, right next to the patient ID, which is a unique ID. When I click on this, we have a little bit more information than we had in the previous system. We've got all the demographics. We have their languages, any care providers associated with that patient, their next of kin, and any support persons. We also include their insurance. And for consent managers who do not have medical provider roles, as soon as they open up a patient record, this is all that they're going to see. They're not going to be able to see the data cards and so on. So it is role-based, and it is smart enough to know, hey, this is how I open this up. If I want to add a consent as a consent manager, I would just click on this add button. And then we're going to be provided what kind of consent is this? Are they opting in, opting out? Is this protected data, and so on? So we're just going to say this one is protected data. And we are going to choose that they're opting in. Or we can choose opt out or an overridable opt out for break the glass. We can set an effective date range. So if we want to start this as of today, that would be 7/20/2000. Oops. 20. Wow, I can't type today. 07/20/21. And then if we do not set an expiration date, our system is set to default for 1 year. So that would opt them out at that point. Or you can choose, hey, they only want to have this viewable for the next month or so. Here we want to make sure that we're always choosing a file. So this is where they're going to upload the actual opt-in or opt-out forms. And they can just choose one from their desktop and so on. We'll just go ahead and choose one here. And then once they've chosen their, oops, it removed my date here. So I'm just going to go ahead and choose today. Now I'm going to go ahead and click add, and that would add the consent. But I'm going to hit cancel here. From here, we can also see any attachments, and then the crisis summary will be viewable only to those with Part 2 access, which we will cover in the training in the later this week. Any other questions, comments?
I'm not seeing any, Sarah.
Okay.
And if that's that's the case, if you want to stop sharing, Sarah, and we will move on to Christy in our alerts in our portal. Before we do, does anybody have any last minute questions while we have the portal still up? Please feel free to either put it in the chat or come off mute. I know we have a lot of people, and that's probably a dangerous thing to say, but I want to make sure we don't miss this opportunity as well. Okay, well, let's go ahead and move on to the what's going to be needed for the alerts transition. So, Sarah, if you want to stop sharing.
Yeah, I'm trying. I'm not actually seeing where to turn it off.
Okay.
Oh, here we go. There we go.
And you should be able to see the alerts transition slide now at this time. Christy?
Thank you very much, Keith. Really cool and exciting, yes. As a former end user of the portal, I can tell you that parts of this make me absolutely delighted for the flexibility and expansion it brings. So how do we get here? Some of you may have seen our initial alert that went out about 10 days ago with some sunset dates in it. So we wanted to expand on what actual steps providers and health information exchange participants need to take between now and those sunset dates in order to be ready. So we'll start with the alerts. So all available alerts actually are currently happening in HIE 3.0 today. All that is needed from an organization in order to transition to that platform and have your alerts generated through the HIE 3.0 is to send us a new patient panel. We've scheduled to sunset the current alert services effective August 30th. So we have a little over 30 days to receive that patient panel from you in order to get that going. Next slide, please. And then we should have portal. There we go. Portal transition has a few more actions that organizations need to take. We just showed you the portal service in HIE 3.0 training environment, so it's all set up and ready to go. There is required training for each organizational user in order to be able to be issued credentials to log in to the portal. That would include new usernames, new passwords, and those would be issued to you upon completion of the required training. We are scheduling to sunset our portal services on September 30th. So all of this training needs to be for all your organizational users by September 30th of 2021. Next slide, please. A couple of ways you can get access to the training. First and most common, simply reach out to your Health Current account manager and they can get you set up for that. We also have a registration link on our events page that includes a listing of all the available trainings. I think they're scheduled through the end of August on a multiple times a week basis so that we can get as many folks through that as possible. If none of those times work for you though, also reach out to your account manager and we'll get some alternative times set up. Next slide, please. So yeah, most importantly, reach out to your account manager or to HIE support at healthcurrent.org to get those questions answered. And I think we're going to open it back up for questions related to the rollout process.
Well, and I also want to make sure that we get all the questions that were put in the chat as well. So let me bring up. There we go. So there's a couple questions in the chat. I'm scrolling through them because I was trying to answer them as we're moving forward as well. I addressed the ones with consent, the migration to HIE 3.0 automatic, or are there steps we need to take in order to migrate over? Christy just went through those. If you're fully integrated bidirectionally, we've already moved all those feeds over and we've been working with data sources and those that do have those interfaces for the past year to make sure those are all up and running. So now we're down to the alerts in the portal. So follow the slides that Christy just went through. I would also say, because it's been asked a couple times, everybody's going to need to go through portal training. This is as much to be able to set the role and the right username, as well as to control who has access and who does not to our environment as well on that. So it's extremely important, but we will work with you and your organizations. We have webinars and we have web-based training. Sarah, our Director of Education, responsible for that, has done a great job along with Caitlin to make sure that we're doing everything possible to make it as easy as possible. And then what is a new patient panel is there? So patient panel is how we do our alerts routing. It's where you will upload your active patients that you want to be alerted on into our environment, secure file transfer folder that we have. And then based on that, we will alert back to either an SFTP, your environment, or a direct secure email. So the new patient panel, we're running new ones in our new environment to be able to set and go through all the matching and everything that's needed to establish those alerts for your organization. We've already got a good percentage that have been transitioned over. I think last month we alerted out of HDH close to 6 million of our alerts came out of our new environment, if it was not 7. So we're already seeing that transition has been going on for a little bit of time. And Sarah, I believe that's you. The training will be interactive as well as participants. So that was from us to everybody else. Any other questions? Or is that all the questions?
No, there's another one I think that's important. All user or just admins attend trainings.
All users.
All users,
So,
anybody who have a log on.
And that's all users that are logging into the portal need to attend the training.
How long,
So,
Sarah?
Yeah, they're 90 minutes long. It allows time to actually interact with the portal. It is not me talking for an hour and a half. It's you guys having activities, searching for patients, searching for clinical items, and getting used to the platform.
yeah. And I want to be really clear on the one point. This is for portal users, mandatory training. You can upload your patient panel for the alerts, contact your account manager and client support. Let's move the alerts forward without the training, but to have access to our portal, you have to go through the training. So is there a way to manage users in this new platform? So this is, we're starting off with the training. So the training is part of it. When we start the training, how we manage the users is we'll establish your username and password based on the role that you have to be able to access and see information. We will also manage who is and is not authorized to go in there. You're also going to see where down the road, we're currently looking at bringing on a management tool to help with this as well as the security. And I don't want to go too far down that path because we're currently vetting it, but it's Okta to where we'll be able to say we have 3,000 end users, all 3,000 are active end users. Here are all the roles and work with the organization. So if somebody leaves, we'll be able to turn off their access pretty quickly from that perspective as well. So we have built in greater levels of end user management as well into this environment. Does that answer hopefully that answers your question? We will still manage. So if somebody leaves your practice quickly, we will manage those. We do have something on a roadmap, but it's probably not until 2022, where we've been looking at functionality that has a end user or a functionality to where you could actually go in and turn it off and on as well, but that's not going to be rolled out for at least a year plus right now. We are working on that from a roadmap perspective. But right now, if somebody is leaving, call us. We do have our lines. We will go in and we'll turn it off, the access. That'll be combined. Caitlin, if you're on, because you run this, is there anything you'd like to add to that?
No, I would suggest if you have users that are leaving your organization, please reach out to HRE support, and then we have a dedicated staff managing that inbox, and we can activate or terminate or deactivate your user account as soon as we receive those requests.
You know, I would also add, because you key to memory, one of the other things that we're looking at is we want to only maintain active users. So if somebody's not in the system for a period of time, we're also looking at working with the organization to say, you've signed up 20, 5, 10, 15, 20, 100 users, only these 5 are active, these are not active. Do you want to keep them? And if so, you know, they're going to need to go through training, or we're going to have their username go dormant, or they're going to have to reset their password. Because we just can't afford to have usernames and passwords out there for months that aren't being used. Those are all risks where our new management is mitigating those risks. So we can actually identify who and how often individuals are logging in, what they're logging in to see, and running audits on that as well.
And
So right now oh, yes.
can I add something to that along the line with the portal onboarding process in the new platform? Our account manager will reach out, working with you to transition over into the new platform. One of the caveats is that if you have an existing user in the current environment, we will not migrate, but rather we'll set up for the user that will complete the training, and then we'll grant it access to the new environment. They will not be automatically migrate over from the current environment.
Thank you for adding that. That was one of the questions earlier. And also the question that just came in, how long before an account is deactivates or is deactivated? Hopefully I'm reading that correctly. So right now we're looking at a 60 to 90-day period. We're still establishing exactly what that is as we're working with our end users, because this is where we really want to understand how our end users are. We're not going to go beyond 90 days. I'll just throw that out there as part of the privacy and security team. That is the furthest out that we'll go. And it's not deactivating from the perspective that we turn it off and you're going to have to request a new password from that perspective to have it turned back on. So your username doesn't just go away, your role doesn't go away. We just cut down or shut off your ability to go in there without reestablishing that we know who you are with your password associated with that username. And then one of the questions was, is there any recommendation as to who we should have as users? You know, my recommendation, we're actually putting a lot more emphasis on account management and our end user experience. I would say work with your account manager, because it really depends on your business needs and your use cases. If you're an ACO and you have care navigators and you're trying to manage a specific population, it's going to be that care navigator, care coordinator sitting there. If you're trying to tee up records for a provider that's getting ready to see a patient, it could be that MA that's trying to collect all the information possible on a patient prior to rooming a patient. So it really depends on your business needs and your use cases. I would reach out to your account manager to look at what your use cases are and the workflow associated to integrate portal use as well as alerts and who receives those. And Christy, from your provider background, would you add anything to that?
No, I would totally agree with you, Keith. And I think it's a great opportunity for people to be thoughtful about how they want to use the HIE to support their business and their clinical practice. There is a question here about, will agencies be provided audit information for our agency staff usage and non-usage? So I think they mean audit, active logons. Yeah.
So yes, so we are actively finalizing our audits, our audit reports, and which ones will and will not be shared, because it's not, we have audit logs that go across the spectrum of our environment, but we will be working with the organizations. We do already on some logs, when individuals are logging in and we see certain abnormalities or certain things that that don't seem correct, like surname lookups to where individuals are looking up themselves or family members, we send those reports back to the organization for them to make the determination, does it fit within their policies and procedures and what they have established to make sure that it's compliant. We leave that up to the organizations, but we do send those logs back when we see certain things back to the organizations. So we will be sharing, and as we continue down our high trust certification and getting a more robust audit and law or audit perspective in place or process in place, I could foresee us sharing even more based on what some of your compliance and privacy officers are saying they want to see as well. So we have internal restrictions to clients.
Yeah.
Can these be applied at HIE level? So that, bear with me because that's a yes and no question or answer to that question. It really depends on where you're at. If we can control it through a roles-based access, say one of your restrictions are this level of staff is not authorized to receive any protected or 42 CFR Part 2 data, we can apply that based on the role and what they're authorized to see. If part of your restriction is that individuals within your organization are not authorized to view family information or look up surname information, that's something that we cannot apply, because you got to remember we have 12 million patient records. A lot of us have the same names, and this is where we provide those audits back to you. But we will work with your organization to determine exactly what we can do based on role-based restrictions, what we cannot do that is a policy indigenous to your organization, and then what are some of the audits that we have in place that can help support you so you can make sure that your policies are being enforced as well, and that we're providing you the appropriate audits to make sure that your staff are complying with your policies internally. Okay. Who at the organization receives the reports? This is where we deal with organizations that are one FTE provider all the way up to organizations that are thousands of FTE providers. So some organizations have privacy and security officers. Some have somebody that's wearing every hat in that organization because it's just a couple of providers that they're supporting. This is where working with your account manager and with Health Current will determine who is best suited to receive those reports based on authorization and what your organization needs are in their business cases. So in some cases, if it's a smaller organization, the provider might decide that they want to receive that, or might designate somebody in their nursing staff or their MA or one of their administrators. In some of the larger organizations where they have privacy and security and compliance officers, they might want some of those reports going straight to their compliance officer. So this is going to be based on the organization and the structure of that organization and who they have in place to receive those. So a lot of this is done individually, but it's individually based on your organization needs, size, and structure. And I think that's, now or after we do. I would recommend reaching out to the your account managers for the patient panel upload immediately from that perspective, to get in the queue to have your patient panel upload. As far as reaching out to your account reps on portal and use case, it really depends on where you're at. If you want to wait till after the training, have it formalized, and if you're good with that moving forward, stay with it. If there's specific questions that you have, I would recommend that you do reach out to your account manager to have those questions answered, or for your account manager to be able to find who the appropriate person is to put you in touch with as well on that. So my recommendation is it's based on what your needs are and what your comfort level is. If you're comfortable with going through the training and moving forward with that, go ahead. If you want to, on the alerts, to get us moving to meet the deadlines that Christy talked about, reach out immediately to get those patient panels uploaded. And we've got 3 minutes left, and it looks like the questions have actually come to an end. Are there any other questions before we wrap up? And if you want to come off mute and ask a question, please feel free to. And Christy, would you like to any parting words before we end?
Yes, just to remind folks that we will be sending out a copy of this slide deck to everyone who is registered for this particular training. You will also be able to download it from the Health Current website. And then again, for those of you who have interest in seeing some of the more part 2 related features, including some more detail on consent management, break the glass, etc. There's a follow-up webinar scheduled for this Thursday. Christine, I might need you to remind me of the time. You can register for that online and join us.
Hi, Christy. It's Christine. Yes, it's Thursday, July 22nd at noon.
That's great. And looking forward to sharing this with our practice. We were really looking forward to sharing this with you. So we're even more excited about Thursday and excited to get this whole training program going and rolling out HIE 3.0 to the Arizona health community. Thanks for joining us.
Yep.
Keith.
I take 2 big thumbs up. This is exciting to be able to scale, exciting for Arizona, exciting for technology, exciting for our providers. So lots of good things coming. Well, actually, lots of good things here at this point. All right. Thank you all, and look forward to seeing you on our other webinars and or in the training. Thank you all very much for attending.
Thank you.
Thank you so much, Keith, Sarah, and Christy. Today will conclude our presentation for today. And for those of you who would like to join the Thursday session, I did include the link to the Eventbrite in the chat. Thanks again, everyone.